Today I'm going to talk about emotional wellness. That's what this video is about, folks. It's a little bit of freaky deaky mind today. Hi guys, I'm laughing because this is take 3 or 4 or 5 or 6 of this video. The reason why is I want to say something simplistic and not complicated. And I get into this mode of, I don't know what it is. I don't know if it's just my past employment or what it is, but I get into this mode that I'm trying to use fancy words or professional things, and I don't need to do that anymore. So basically I want to help you guys out in a way, and that's why I decided to do some freaky deaky mind stuff to begin with. By helping you guys, I help myself also, just by sharing experiences, and that's all that I am wanting to do, really. But I'm making it a lot more complicated than what it needs to be. Anyway, emotional wellness. What the heck? We have physical wellness, right? We have emotional wellness, we have mental health, we have physical health, all these fancy words. We have mental illness, and some people get mixed up and say, oh, they have a mental health issue. Well, we all have mental health, hopefully. We have health mentally, and sometimes we have illness. Illness can be any kind of diagnosed illness, or it can just be having a shitty week. It could be, you may be just not in a good frame of mind for a few days. That doesn't mean you have a specific diagnosis. That's just how you're feeling. So basically, when I come on to Freaky Deaky Mind, if anybody has any questions about specific illnesses, I'd be more than happy to answer or do a little video, no problem, in layman's terms with my personal experiences, personally and professionally. But I'm just going to speak about behaviors, emotions, and symptoms. Because really, all those other things are labels. They're labels that we need sometimes for benefits. We need sometimes for our own self, so we want to know what's wrong, so we can say, well, I have bipolar disorder, or my issue is this, or, I have major depressive disorder or anxiety disorder, whatever. But mainly those things are good for schooling, for grants, for if you need to say something to your work, whatever, right? It just puts a label on something. But I just usually concentrate on what symptoms you're experiencing psychologically, emotionally, and mentally. What are those experiences? So first off, I just want to talk about health emotionally. Some people will say emotional health, mental health, emotional wellness, emotional well-being, mental well-being, all those things. And the flip side is mentally ill, emotionally not well, reactive, anger management problems, aggressive, loud, like aggressive personality, loud. What else can I say? There's all kinds of different words we can use that may look at psychological and emotional wellness. I'm going to talk about emotional wellness. Do you feel like you're emotionally well? And what that means is, do you feel that any kind of change, situation that comes up in your life, do you feel well to handle that? Right? Even if it's a loss, a great loss. Of course you're going to be upset, but do you feel well enough emotionally, psychologically to get through that? That's the question you need to ask yourself. Do you recognize your own emotions, how you feel? And I'm not saying, oh, I feel sad, I feel mad, and all these things we learn as kids. I'm saying, when you're sitting by yourself and you're just not listening or watching or on your phone or anything, do you give yourself permission to really sit in what your emotions are, right? Do you feel peaceful? Do you feel peace of mind? Are you getting up at night just like can't sleep? Things rolling through your head, and I would always describe it as a hamster wheel just going around and around. Is the hamster going around and around and around? What turmoil are you going through that you need to take a look at? You know, are you emotionally unwell or unstable because of that turmoil that you're avoiding, that you don't want to talk about, that you're making excuses for, that you are just pretending don't exist, that you're burying, that you're washing away in alcohol, drugs, food, sex, shopping? Is any of that going on? Well, yes, it does go on in our lives once in a while. We have a bad day, and of course, like I do it. I'm terrible for the food thing. And over the years, I was terrible for the alcohol thing. So yeah, all those sorts of things happen. But are you living a life of that? Is that your coping way to cope instead of sitting, thinking, and dealing with how you're feeling? I consider myself emotionally healthy right now in my life. Has my life been like really poor and then emotionally healthy? No, of course not. It's been like this. And I recognize that, and I know that. And I know that when it starts to go down a little bit, I recognize it, and I start to make changes, think about what's going on in my life. What do I need to help? You know, what do I need to do? What is triggering this? What is going on? Do I need support? Do I need to go for a coffee with someone? Do I need to talk about it? Do I need some medication for that? Do I need to seek out a professional? Do I need an emergency room doctor? You know, what do you need? Recognize. You're the person that knows, right? It's painful to be in so much pain emotionally. It hurts. It physically hurts. And if you've been there, you know it. I am so grateful that I really make this the most priority part of my life. Some people really make their physical health a big priority of their lives. I need a lot of improvement in that area. I really do, because currently I am living with the damage I've done to myself because of my emotional cover-ups and my emotional coping skills that were very poor, mostly food. So emotionally, there's nothing better than feeling at peace in your mind. That when I go to bed now, I don't have all that shit running around in my mind. I don't worry about it. You know, some people would say, oh, she's a worrywart, or he's a worrywart. They worry about everything. They have anxiety about everything. Well, that's what anxiety is a worry about something that for the most part is not logical, right? You worry about getting in a car accident, but you're not in a car accident right now. Does the possibility exist? Of course. Is it affecting your life to the fact that you can't drive on the highway? Yeah, it does for me. I drive, but I'm very limited in when and where I drive. I have to feel emotionally well to do a really good drive, right? And if the anxiety gets to me when I'm driving, I have to pull over and give myself permission to pull over, go in Tim's, have a coffee, wait for a while, wait for hours if I need to feel good to take on that highway and that speed again. Not everybody does that, do they? Because we're all different, right? We are all different. Don't expect your triggers, your reactions, your feelings, your emotions to be like the person down the street or the person at your work that deals with it differently, right? Just because someone is quiet and they do not react does not mean they don't have feelings. They just maybe make a choice to think about what they're feeling and what is a healthy way to handle or to approach a situation and not react, right? That's not someone who is not someone who cannot make decisions. That is someone who's making and taking the time out to make decisions, to investigate, to get in tune with how they feel before they make a decision, not completely react to something. Do they feel that way inside? All of a sudden, they, of course. Me, of course, right? But before, I would always, hey, that's not right. Like, why you, no, that doesn't make no sense, right? Without really hearing what the other person is saying. Now, I just listen and then I ask them questions. Like, so are you meaning blah, blah, blah? Does that mean that, is this what you mean? You get clarification. And then if it's something in your mind or in your life that you don't want, say it. Oh, I can't have that. Or I'll get back to you on that. How about I'll let you know by Friday if I can help you with that. Instead of saying, sure, I'll help you with it, and then going home and holy fuck, I gotta help this person with this thing, and I don't want to go over there now. I just don't feel like it. Well, why did you say it? Because that's what you're supposed to do. You're supposed to be nice. Who are you looking after? Who are you caring for? Yourself or them? You're caring for yourself. Is it wrong to say, oh, I'm not sure, but I'll get back to you? No, it's not wrong. And there's nothing wrong with it. I always thought I had to say yes. Always. Never say no. And never say, I'll get back to you. I'll think about it. That doesn't suit me. That's not working for me in my life right now. I'm not in a place right now that I can help you out with that. And it, those sorts of things, because we'd rather either say yes or make up a lie to say no. Well, I can't help you because on Friday night I have this event that I'm going to down in the city. You have no fucking event, but you don't want to say no, right? So it's tough. It is tough. However, right now I feel okay. I feel like, and I know currently, that I don't do anything I don't want to do. Am I selfish? Maybe some people would think I am, but I'm not. Why am I not? Because there's no way in heckers I am going to feel so unwell and so depressed and so miserable and in pain emotionally again. Will it happen time and time? Yeah, I'll have days, and I'll give myself permission a few days to feel it and to feel miserable or to feel conflicted or to feel, if I have some pissed off feelings, I'll give myself some time. But then I try to look at it from the outside, right? And outside in, and look at it and think to myself, what's the worst that can happen in this situation? Am I creating a lot of worry? Is there something I can do to ease that anxiety for myself? Can I make a decision that may help me conquer or face or move forward towards that something that I'm fearful of, or that I'm not wanting to do, or that I don't think I can handle? Am I feeling overwhelmed? Can I make a list and look at the things first? What are the first things that I can do? Can I make a list of priorities and then check them off? That way I don't forget, and that way I feel like I'm progressing, right? Can I just sit back when you're feeling really, really overwhelmed with, I need to do this, the car, and I need to pick up this, and I need to go there, and I'm going on a trip, and I need to do all these things, and oh my fuck, I forgot to go in and pay the insurance, and blah, 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 blah. Can I sit back and say, okay, today is Monday. Is it Manic Monday? Or is it Monday? What can I do that needs to be done on Monday? Because I'm not going to accomplish it all. So what is the most important thing that I need to do? What is the worst thing that could happen if I don't do it today? What can I push till Tuesday? That is emotional wellness. When you're not emotionally well, you start to freak out because you have so much to take care of and I can't handle it. I've got this and this and this, and nobody helps me. Nobody's around to help me, and nobody cares. And how am I going to do this? And I just want to fucking fuck everybody, right? We all know people like that. Maybe we're one of them. Maybe we're not. Maybe we are a person like that now, So, what are you going to do? What are you going to do to feel emotionally well? First step, recognize that you're not. All right, guys. Bye. Cool.